Can everybody hear me?
ايه بس لو إذا في سلايدز او شيء
Yeah. And how do I add the slides? One second.
just the voice is a little bit unclear.
Oh, the voice is there. Okay. How about now? Is it clear?
يعني it's better بس can you speak?
Is it now better?
Yeah, it's kind of better if
Okay. Let's upload this slide. هل الصوت أفضل الحين؟
ايه الحين ممتاز.
الحمد لله. طيب. السلام عليكم، صباح الخير. معكم فارس الصالح، resident ophthalmology في كندا. وبس بحب أعطيكم about introduction to ophthalmology and a little bit of talk about the path to ophthalmology in North America. Of course إذا عندكم أي سؤال أسألون أي وقت، وأعرف بيجمعونا في النهاية بس لا ترددون. First of all, we're going to start an introduction to ophthalmology. So what is ophthalmology? طبعا بعضكم يعرف what it is, and for those who don't, it's a branch of medicine concerned with the eyes, the anatomy, the function, disease, and meaning just medical and surgical care of the eye and the adjacent adnexal and periocular area. So what's a specialty like in real life? It's a minimally invasive microsurgery, a plethora of different kinds of treatment lasers, plastic surgery of the periorbital area and adnexa. طبعا الناس اللي تشتغل معهم كل أنواع internists, intensivists, optometrists, ophthalmic nurses, technicians, medical assistants, rheumatologists, endocrinologists. You really work with almost everybody in the hospital. And subspecialties are actually endless. You can cornea and external disease, glaucoma, neuro-ophthalmology, oculoplastics, medical retina. There's so much. It's people that always forget that about ophthalmology. So, and what's the point of ophthalmology? Well, there's a global impact of blindness. You have it every 5 seconds, an adult goes blind somewhere. Every 60 seconds, a child goes blind. 45 million adults and 1.5 million children are blind, and about 135 million are visually impaired and actually can be helped. What are the main causes? Of course, عندنا في السعودية أهم أشياء بالنسبة لنا like glaucoma, diabetic retinopathy, AMD. It's more in the developed countries kind of thing, but there's also other stuff like vitamin A deficiency and ocular cases. So let's talk about why ophthalmology. First of all, ophthalmologists are at the forefront of medical research and innovation. And you'll see this in all the symposiums and conferences, and even the centers you will hopefully end up working in, is that there's so many opportunities to actually pursue in research that it's quite crazy. Especially for people who are like actually want to be clinician scientists, a lot of centers offer this kind of option because they have a lot of research on a lot of things. And then that includes gene therapy, stem cells, regenerative medicine, vascular biology. Second reason, the surgery is a lot of fun. It's one of those very fun surgeries that are under a microscope, and you basically have endless possibilities. Here are some pictures of what it can look like. It's always under a scope, a lot of screens. As you can see here, we're doing a vitrectomy and also a bit of cataract surgery. Usually it's not this bloody, but sometimes it can be. This is like your usual bread and butter cataract surgery, which every surgeon is going to have to do in their residency. Of course, another important reason is endless opportunities in global health. So you have a million organizations, and if you're interested in global health or public health, it's probably the most active in the world and that has the most opportunities to do so. And of course, there's some subspecialty for every person. Like surgical, you have cornea, oculoplastic, surgical retina, strabismus. In medical, you have uveitis, neuro-ophthalmology, medical retina. Then you have those mixed specialties like glaucoma and pediatrics. It has maybe one of the best excellent work-life balance fields in medicine because you do have on calls, but they're not horrible. It's only bad the first few years of residency, and then you basically will have a nice balance so that you can enjoy both. And what's really importantly, we have a lot of toys. We have a lot of lenses and machines and slit lamps and lasers. It's really, you think it's overwhelming, but it's actually a lot of fun. Yeah. So what's the disadvantages? What I can think of, honestly, it's very competitive. You need excellent vision and 3D vision, which almost I think every program checks before applying, and can seem very intimidating as a student because basically, I'm sure some of you have noticed, you go for your elective and you're just sitting in the corner. You have no idea what they're doing, and you can't even see the back of the eye sometimes or examine the eye. So if you can get over that, you can find that ophthalmology is very appealing. So let's talk about the kind of pathway to ophthalmology. I know that a lot of you care. That's why you kind of want to ask about. And I'm going to start with how I basically got started. And then afterwards, I'll discuss what is needed in ophthalmology. And then we can have some questions, kind of get your guys' questions and answer them, which I think is a better way of doing things. First of all, for me, I did right during my last year of medical school جاني البوزيشن حق معيد في سنة حوالي خامس نهاية سنة خامس, and then بديت local program about 7 to 6 months. After which I got accepted into a Masters of Public Health at Johns Hopkins, which was 1 year. And then after that, I did about a year and a half of research fellowship, in which after at Wilmer Eye Institute at Hopkins, and then I got accepted in McGill for ophthalmology. Now, each portion of that journey was different because initially the plan was the US, but it wasn't as easy as expected. And at Hopkins itself, I did a lot of research heavy on ophthalmology, which continued into my research fellowship after the fellowship. So basically, the things that you need to apply to Canada, which are they canceled the MCE, so now it's the MCCQE1, and basically your medical school records, recommendations, and exams. And also the US, the usual step 1, step 2, and step 3. An important thing to know about the US is I think the last time they accepted an IMG from the Gulf was maybe 10 or 11 years ago. I'm not sure. It's very competitive in the US to a big degree. So to even consider it, you're going to have to think about either a PhD or an extensive research fellowship, so somewhere there, which I know is hard these days. And also, one of the things that's difficult is getting into actually finding the research fellowships. I know as sponsored right now. So I think the best course of action is probably Canada. In terms of Canada, the past few years, the positions that have opened for IMGs are at McGill University, University of Toronto, and recently Ottawa University, University of Ottawa. Other centers have not yet begun to accept, but those three are actually pretty high numbers. So McGill accepts 2, Toronto accepts 2, and Ottawa accepts 1. And I think they have those positions every year. طبعا the US, the projection is that there's going to be less ophthalmology jobs. So there's going to be more ophthalmology positions opening up because of the economic situation. But that's just projection by some people that actually think about it. However, I mean, Canada is your best bet, and it's the thing I would tell most people to kind of push for, because you actually have a very good chance. Now, in terms of how to familiarize yourself with Canada, you do need to do an elective. But I have to say something is that Miguel does not provide electives except for medical students. So if you're finishing up your internship year or you're outside of medical school, Miguel will not offer you any kind of elective in ophthalmology. Toronto does, and Ottawa from time to time, there's an official application to that. In terms of the interview process, Miguel, because it doesn't take any electives, does take a random, like anybody who applies, they screen their CVs and their reference letters, and then they give them interviews. Toronto will interview people they don't know, but they do usually accept people they've worked with, either an elective or a research project. Ottawa is the same as Miguel. They just like basically will interview people they've never met, and then choose based on interview and credentials in terms of your CV, exams, etc. So I think what I want to do right now is I want to just see what questions you guys have, because I feel that's more important than just like telling you guys on and on about different things. So everybody who has any question, we'll try to answer that and try to just have a discussion about like what things are you guys worried about, what do you guys want to do about it, and what are the things that makes you guys wonder about how to get into something. Let me just exit that. Okay, so one of the questions is, could you please briefly talk about your story of trying to match into ophthalmology in the United States, and what can we do to match there, and how can we take electives in Johns Hopkins? Okay, I'll start with that question. First of all, in terms of matching into ophthalmology in the United States, I have to be realistic with some people, with some of you, in the sense it is extremely hard. It is very competitive. So your best course of action is, first of all, to go through either an academic program, like a master's or a PhD, so that you can familiarize yourself with the department there. And once they know you well enough, they will give you electives. They will put you in research fellowships. They're very open to that all the time. I think the main issue is going to be finding funding and sponsoring for that. That's going to be your main issue. In terms of how can you apply for a Miguel elective as a medical student without a recommendation or a reference letter? You don't need technically a recommendation reference letter. You just need to kind of apply through the window of the application, which I think there is between KSU and Miguel. If I'm not mistaken, I don't know if the portal is still there, but I remember it was there and you had to apply for it to get into it. What always sometimes can work is emailing the program director of a program directly. And if someone wants that kind of contact information, I will give the organizers my contact information afterwards, and you can contact me. We can talk about that and see how we can help you with that as much as possible. How is the acceptance and fellowship program in Canada if I have guys from outside of fellowship programs? So the fellowship programs in Canada are actually, they do accept quite a few residents, like actually graduating from Saudi. I think that you are competing with the other Khalijis, so you have Omanis, Kuwaitis. Basically, that's it. I think sometimes some Emiratis, but mainly the Omanis. chances are if you apply, you will probably get it. You just need to have your exam ready and good references, good research. And I've seen a few fellows pass by from back home, and they did really well. So they open applications, but sometimes it's not very clear. So it's always good to ask and email the people who work in these departments in these University of Toronto and Miguel mainly, because they're the two that do fellowships. So Toronto will have oculoplastics, the retina, glaucoma, cornea, mainly, and then Miguel has retina and glaucoma only fellowships. So I think in Toronto, the main place to give to fellowship is probably Toronto. So it's not that widespread. The other centers don't give fellowships to IMGs. It's mainly for their local people. Another question is regarding the acceptance of plastic surgery residency in the United States. Is it as hard as ophthalmology? What can we do to increase our chances? Plastic surgery is as competitive as ophthalmology, no doubt. It's one of the top 5 in terms of difficulty of getting acceptance. I don't think the acceptance differs in the way what I just said is you have to choose either route of a academic degree, like a master's or PhD, that translate from research into um, the residency, or doing a research fellowship with a distinguished person, like a program director or chairman of a department. Um, that is, I think, the best way of doing it. Of course, I have to admit that they do care about your step scores, especially step 1 and step 2 CK. They care about the, as an IMG, about the score. That is your entry point usually. Is it necessary to take a master's degree before residency for applying to Canada? Actually, no, it's not necessary. I think if you did electives in your medical school or after medical school in North America in general, preferably in Canada, but if you have North American experience, there's a big chance you will get an interview. But I do emphasize always doing an elective because it really matters, except at Miguel, that you worked with them. Even Miguel, once you have even though they don't give electives, once you've had North American experience, they do prefer it because they feel that, which is unreasonable, I think, but they do feel that you have some understanding of the system, so you will be able to transition smoothly. But no, the master's degree is not necessary for Canada. It's not important. I did that it was a personal choice for me. So there are 5 positions each year in Canada for IMG. Well, yes, there is 5 that fluctuates though, so it's not fixed. So don't just assume it blindly. Usually since I've started, it's been 2 Miguel, 2 Toronto, 1 Ottawa. But I've heard that it fluctuates. Sometimes Ottawa doesn't, sometimes Toronto is 1. Miguel has been pretty consistent over the years for 2 people. How much does the Miguel elective cost? Honestly, I don't know. I don't know how much. I don't think it should cost much. It is. I think it just administration fees and visas and stuff like that. But I don't think it costs a lot of money. But the thing I don't know the difference because from what I remember, for the medical students that pass by me, we're usually applying through the KSU portal, which is I don't know if that's still a thing. But you will have my contact details later to kind of just be able to ask me these questions and quite maybe email the PD and see how electives can happen. In terms of for a person who's asking contact info, I will be providing it to organizers, whoever needs it, and you guys can feel free to contact me. I'm a medical graduate. How can I increase my chance of acceptance? If you already graduated, I think that the following steps would be best is find a sponsor, which I think is the most important step. Find a sponsor always, because the moment you get accepted, you can go right away. Second of all, it depends, are you in a local program or you're not in a local program? Because you need to be making use of your time. Like when I say make use of your time, I'm not saying just like you have to do a specific thing, but you have to be busy with something that kind of pushes you towards the goal of residency. So either research, electives, doing local, which I've seen a few people actually get accepted through a local program. Usually they do a year and then they interview and they get accepted. How difficult is the language barrier? Do you recommend learning French? At Miguel, the barrier is it can be an issue at times, but you can manage with English easily. I do recommend learning some basic conversational French so that it will make your life easier. But I came here knowing zero French and I still know very little. And I'm doing very well and I'm not having any problems. So it's not the biggest of deals, honestly. It's just a social thing that will make your life easier. Is it usual that I join local programs and if I get matched in Canada, I take my residency there? What about if I want to work for the same hospital as from Canada? Well, local program it's normal. I think if you match in Canada means you need a sponsor. So the sponsor that's going to sponsor you is going to bring you back to work there. So I don't think you're going to end up working in the same hospital unless they already agreed to sponsor you. That's the issue with applying. You have to have a sponsor. So if you're in a local program, you have to find either idea with a scholarship program or a hospital that needs staff. I know that Al has stopped all open scholarships. So you have to be sponsored by an institution now to get into a residency. So you can't just apply, I think, just with your name and then hope to get a sponsor. I think the new way of doing it is that you need to have a sponsor before. كيف خلصت الماسترز بسنة؟ كل برامج يمدي خلصهم سنة مثل MBA. So when you search for public health masters, some of them are 2 years and some of them are 1. They specifically point it out. The 1 year is very, very like compounded. It's very heavy, but you finish it in a year. The MBA, MHA, MMMM, I think most of those programs are 2 years. It's part of the reason why, because initially I was doing the Masters of Public Health and MBA. Then I realized it was 2 years, so I dropped the MBA. So I think the MBA and the MHA are definitely 2-year programs, if I'm not mistaken. Now, to apply to these masters, I think you have to apply through SOAPS. SOAPS is a portal, if any of you are interested. It's a portal that you upload all your information into, and then they apply for you to certain schools, and they tell you if you're accepted or not. Can you talk a little about the workload for an ophthalmology resident in Canada? I'll tell you how it is. So every institution is different in the way they do things. So Miguel, for example, the first year is an off-service year, and the second year is a service heavy. So you have the pager of the service, and you answer calls for all ophthalmology consults and emergencies. So it's very hectic the second year. The third year, you go into subspecialties, fourth is surgical, and fifth is surgical. So the workload is mainly heavy the first 2 years. It's quite hectic. It does get better, but it is busy. The Toronto is the same thing, but the difference is Miguel is front heavy. So you have more on calls at the beginning of your residency, and then it decreases each time you're more senior. Toronto, it's more equal across the years. So it doesn't matter how senior you are, you always have the equal number of calls with everybody else. Is it possible to start the residency right after the internship? It is possible, yes. And the way that would work is that you apply, it will not right away. You will always have a gap year, always a year. Like even if you get accepted in your internship year, you will probably have to wait a little bit to the following year because of the application process, because I think you need the internship certificate. So I think everybody the earliest I've ever seen someone start was after the internship, not right after it. I think because there's always that little lag. How many years ophthalmology residency in Canada? It's 5 years. If I like ophthalmology very much, but I don't like the surgical part, what difficulties would that I will face in the pathway of my acceptance and learning? So ophthalmology has a lot of medical subspecialties, like I mentioned before. Neuro-ophthalmology, uveitis, medical retina, and they're very fulfilling, actually very fulfilling careers, because you don't have to do surgeries and you're making huge change in people's lives, and it's the kind of subspecialties that a lot of centers need, like uveitis, neuro-ophthalmology, and medical retina. There's quite a few, but those two I know for a fact that the vast majority of institutions in the Middle East and outside are very keen on. So if you go into ophthalmology just wanting to do medical, you will actually probably have the easiest time finding a job. That's like quite interesting, but you'll find a job right away. During residency, you will be expected to do surgery, and the surgeries you will be expected to do are cataract surgery, procedures like laser and different kinds of lasers, which aren't really surgical procedures, they're laser procedures, some basic suturing and the stuff that you have to do in residency, but none of the complex things. You could pass by without doing those easily. So would have a very good career, but you would have to focus on those specialties that are only medical. What are the differences between Saudi and Canadian residency in ophthalmology? I think both are excellent. I think the local program has a lot. I think the Jam'i and the King Khaled Specialist Hospital are quite good. I think the main difference would be cataract surgery numbers. So, for example, at Miguel, I think the minimum we get to do is about 300, 350 cataracts at the end of residency. That's higher than most averages in the US. And Canada has that high averages in general. And for Riyadh, I think the numbers are much low unless you go to India and other places to kind of up your numbers. So if I had to say the biggest issue would be the difference in cataract numbers, and also the accessibility to North American physicians, which is important for fellowships, makes it easier, etc. That's I think the realistic answer. However, in terms of clinical skills and exposure, I think they're the same, if not better in Saudi, because you get a lot of interesting cases. I think those are the main differences. There's nothing really that big, but it is a big difference when you talk about surgery numbers. So that is important. I don't know how. That's what I remember from Saudi when I was in the back, and the numbers were low, like 80 to 90 per resident at the end of residency. Would a high step 1 score increase my chance of getting accepted? In ophthalmology in Canada, they would look at you in interest, because it's probably good to put it in your CV and application. They would care about it, but I don't think it's a significant factor for or against. In the US, absolutely. And in the US, it's probably the most important score to have, and step 2. That's their screening tool. Like without a higher score, and you'd have to know the average every year. Like most people won't even get into the application process because of how competitive it is. I am currently a 4th-year medical student. Do you recommend me proceeding for step 1 in hope of scoring above 250, or wait until the pass and fail system to be applied and focus on step 2 CK? Honestly, it depends on if you're 4th year, that means you have 2 more years. I guess that would make sense, but taking your steps early can help you get electives early. So you can start applying quite early on into the US. and it helps you, centers want you. So the only thing I would say about waiting for the pass and fail, which is reasonable, honestly, the only thing I would say about that is that you want to have your steps ready for when you apply for electives, especially as a student, because it does make them want you more to know that you're already done taking your steps, because you make them like they're medical students and they feel more comfortable taking you then. That would be my only thing about that. Otherwise, there's no, in terms of application, there's no difference in timing for you, because I know by that time it'll be pass and fail. And I would definitely take step 2 CK if you can, as soon as possible. What is the average minimum number of researchers required for ophthalmology? So the thing is, it's not a number. And this is something that it's important to emphasize. Numbers don't matter in research when you're a resident or you're a medical student. It's quality of research. Meaning, if you have 1 or 2 really good projects, in the sense of projects that will be published in international journals, especially the big journals, that is amazing. And that's what they look for. There is no minimum number, because sometimes even if you have a lot of research and it's not very good research, it can look bad on you. Like you're just putting your name onto researchers and you don't really know about them. Because in interviews, they will very much ask you about your research. They will go in depth. For me, as an example, in my research fellowship, which might not sound like a lot, I had only 2 projects. But the projects were, one was a surgical trial, randomized surgical trial, and the other was a huge project, another something else. And that actually was the reason I would get accepted, is because these projects were quite influential. So I would always focus on the quality over the number every single time. What do you recommend us to do in our college years to do in order to be very competitive in North America? What are the qualities that North Americans usually seek in MS and in medical students? Extracurricular activities. They really like the things, the campaigns, leadership positions, teaching activities, anything outside of medical school really goes a long way. Like having interest and stuff outside of medical school is really important, and they actually look for it, because when they're reading your CV, what they're reading is, can I work with this person? Now, if your CV is all medical and no interest, no activities that you put in there, they can't really see the person. So they'll probably not be as appealing to them, even if you have a really good academic CV. So always remember that as good as academia is, you have to have things on the side, things that actually show that you're very well-rounded, you're easy to work with, you would be easily transitioned to their program. I suggest that all of you take either the IELTS or TOEFL. Having an English competency exam is so important when applying, because they suddenly ask you, you don't want to be put in that position where you don't have it. So I do recommend everybody to have an exam, of a valid one, when you're applying, always. And have someone help you with the personal statement. Write a personal statement that makes someone want to read it. Sometimes when we get applicants through Canada and we see that they have amazing CVs, and then we read their personal statement, and it's very simple in the sense of they obviously didn't put a lot of effort into it. The personal statement is really what, like, it's very important. Again, I can't emphasize how important it is. It does give them introduction to you before they meet you. So that would be like my advice on how to be competitive. Do a lot of extracurricular activities, have things outside the hospital, be research oriented and involved, and have an elective. North America exposure is invaluable, in my opinion, really invaluable. If you have a recommendation or a reference letter from someone in North America in a good institution, your life will be a million times easier. And for the people in Saudi who you have staff اللي تخرجوا من North America, try to get them to call or make references for you. That makes a big difference. We have a few graduates coming from Canada and the US, and a single phone call or email from these people, I can tell you, will get you very far. Will at least get you an interview, at least. Does Miguel need IELTS for applying, and his IELTS score makes me superior over others who don't have it? Yeah, it's not about you. You have to have it. It has to be there. They won't take your application without an English competency exam. It will not be even thought about. Like, and having a good, there's a minimum score. I think it's 7 on all sections. So you do need a good score. It's not about a matter of being superior. You will not be able to apply without one. If I'm interested in getting in the local board, do you recommend me to take electives in KSA or in Canada? If you're going to do the local program, I would definitely tell you to do electives locally. Do it with the program directors and the chairmen. Make sure that you work with them. No benefit of doing it in North America unless you have some interest as a plan B to do outside. If you're only going to do local, only do local electives. They need to know you well and they need to want you, because I know it's very competitive. Should I include a research that got published but not ophthalmology related in my CV? Of course it should. If you have good research in other specialties that you published, put it in there. And if they ask you about it, I tell them you were a medical student and you were exploring options, but they definitely like to know that you did the research. That is always a pro on a CV. Having published research on your CV is always a pro. You never hide that, but always be ready to know about it when they ask you about it. Because the worst thing that can happen in an interview is if they ask you about your research and you're quite shaky on it. Are MCC, EQ, and USMLE exam required to take electives abroad? So in Canada, no, it's not required. You can do, as a medical student, you can do it without them. Even as a graduate, you don't need to, because technically you're doing an observership, but you will be working. But technically, that's what it's called. In the US, it depends on the center. Some centers will give you an observership, which I think doesn't need UCMLEs. However, other places are electives where you will be working with residents, so they will require your steps. In my opinion, in the US, you should always finish your steps as soon as possible, because it opens so many doors for you. And it really opens a lot of doors. How many electives would be ideal? Elective that would be a number of electives that would be ideal. I honestly, I don't know. I think it depends on what you get out of it. So you have to have a goal in going to elective. You want the departments to familiarize themselves with you and like you. Basically say, oh, we can see this person working with us. So some people can do that in a week. Some people need 2 months. So I would have that mindset when you start an elective. So it won't matter how many you do. It's more of, they like me now and they want to work with me. They've seen I'm professional, I'm easy to work with. Then you are set, basically. So one elective could possibly get you an interview easily. That's what they want. They just need to see that you had North American exposure and they liked you, like a reference letter or a recommendation from a place you did elective in. So even one is enough. Should North America exposure be medical only, or it can be also a cultural exchange program, for example? It's only medical. I don't think they do any kind of cultural exchange programs anymore. It has to be very specific in where you go. They don't have the culture, like any of that anymore. It's just basically if you have to have a acceptance somewhere and you go there. I don't think there's any kind of cultural exchange program. Let me see. If I didn't get an acceptance in local program from first year, is it easy and worthwhile to prepare for Canadian program? Let me think. I think to prepare for the Canadian program, what you need is just the exam and your recommendations and references. It's always worth applying. But you're going to have the issue of, if you apply to local again or apply to outside, because local programs want to know that you stay, that you're not going to leave them. So if you're talking to another institution about sponsoring you for abroad, you're going to have to balance that very carefully, because I know that some local programs will not accept you even if they like you, if they think that you're gonna leave. I know that for some of them do that, except the AlMohaimede, who I think do a year of local. Otherwise, I think they don't like it. I've from personal experience, they don't like it. Is a research program in North America as good as an elective? I think so. I think a research program gives you an opportunity to do electives, because when you're doing a research program, you can talk to the staff there that you're doing research with to kind of observe them, do rotations with them, and all the while doing research with them. So it is superior to an elective, in my opinion. It's much superior, but it takes longer time. It's at least a year. That's the difference. So you have to commit to it, and you have to have an end goal of research projects that you publish. If I want to take my residency locally and my fellowship abroad, should I mention that in the residency interview, or it will affect my acceptance? I do think, no, I don't think that will affect if you're honest about that, I don't think it will. They will make sure, they just want to make sure that you're not going to leave residency in the middle, because that can affect them. I think that's the main thing. But I wouldn't talk about fellowship abroad in the interview. I would not talk about it. I would avoid saying anything about it. And if you are interested in it during residency, you start talking to the departments and asking them to get acceptances to fellowships. I would not say that in the interview, just to be safe. Just talk about why you want the residency. What are the global health volunteer opportunities a student can do? Oh, those are endless. What I can do is I can send a email with the organizers, with like organizations that actually help with these things, and I can, so people can have access to them and kind of be able to get in contact with them. There's so many opportunities. I'll send it by email, like so that they can distribute it to you guys.
Okay, I think that's all the questions we've had.
Yes.
Thank you so much, Dr. Faris, for an amazing lecture and for answering all the questions we've had.
Oh, no problem. And I'll just give you guys my contact info afterwards.
All right.
And so you guys can, like, if anybody has any questions, they can email me, and like from the email I can give them my phone number to kind of just talk about what they want.
Sure. Thank you so much. It's been a pleasure having you on
No, it's no problem. It's my pleasure. I think there was one more question.
Oh.
What is the minimum period of a research program in North America? Do they give me an opportunity to publish a research with them? Usually it's a year. The minimum is a year. You can't do less than a year. And yes, you will be publishing research with them. I think that's the point of it. Okay. Okay, perfect. Is that the end of the lecture, or? Yeah. Okay, perfect.
Thank you so much.
Oh, you're welcome.
If anyone here is interested in neurology, please check out Chesra Camp.